how long does vaccine immunity last?
So that's a very important and big question. How long will the vaccine immunity last? And will it vary from one vaccine to the other? And which is giving a longer degree of immunity? Now, this is a question which we can only answer next year as we follow up these patients who are vaccinated. What the data suggests is that the immunity will last definitely for more than 6 months. It may last up to 1 year or longer, but we really need to see how long it lasts. And I think the other important issue is it the same? Is the immunity the same in all age groups and in all groups of people with comorbidities?
Right.
So those are the important issues that we need to really answer. But this will happen only as we follow up our individuals who have been vaccinated and test their antibodies on a serial basis.
I think, the allied question is, is it okay if you've got the vaccine shot, can you then stop following the protocols of masks and sanitization and social distancing, or even after receiving both the vaccine shots, should those COVID protocols still be followed?
Definitely. The COVID protocols should definitely be followed, and they are for 2 or 3 reasons. One is you have to get both the 2 shots. This is very important. Just the first shot will not give you enough immunity. You must get your second shot 28 days later.
Right.
And after that also it will take at least 2 weeks for the antibodies to form in sufficient amount in your body for you to get the immunity and protection.
Right.
But having said that, it's also important that your immunity, you may have a good immunity, but you may still get COVID, but it may be of a mild form.
Okay.
So the vaccine may prevent you from getting severe COVID, but in some individuals, it's not going to give you 100% immunity that you will not get COVID. It won't let you get a severe form of COVID. Even if you get a mild fever, cough and cold, you may not have any problem, but you may be infectious to others, and you may spread the illness to other members in the family who have not been vaccinated as yet, or who may have a lower immunity. Therefore, I think even after you're vaccinated, it's very important that we follow COVID appropriate behavior till such time that we really can say that our cases are really down to a minimum and that the pandemic is over.
So, Dr. Guleria, what you're essentially saying is that we don't know yet whether the vaccine shot is 100% of a magic bullet. You could still, after getting vaccinated, also get the coronavirus, but perhaps it won't be life-threatening or may not be very severe. Is that what you're saying?
Correct. So when we look at the vaccines, we're looking at 2 things. Does the vaccine prevent you from getting the infection, or does it prevent you from getting severe disease? So currently, we are sure that the vaccine will prevent you from getting severe disease. Even if you develop COVID, it will be from a mild form. An ideal situation, which we would like, which would be an ideal vaccine, is that it prevents you from getting the infection at all, and you don't get COVID once you're vaccinated. I don't think that we can confidently say that the vaccine will be able to do that right now. Hopefully, with time, we may be able to have a vaccine which could do that.